So if somebody has ovarian cancer, I would say first get yourself to a gynecologic oncologist. This is what we do. We have been trained to take care of women with these cancers, with these diseases. Just like a mechanic fixes a car and he's not going to fix your washing machine, he's going to fix your car. This is what we do. We take care of women with gynecologic cancer. This is where our passion is, and this is what we've dedicated our lives to doing. And if you go to a gynecologic oncologist, there are certain questions that you should ask. Obviously, what is my exact diagnosis? What is my treatment plan? And it should usually be surgery first, and it may be a second surgery if the first surgery wasn't a complete comprehensive surgical procedure. And then you may want to ask some questions about, well, will there be treatment after the surgery? The problem with that question is that sometimes the answer, or most of the time the answer will be, well, your treatment after the surgery will depend on what the findings are at the time of the surgery and what the final biopsy results are a week later after the surgery. So sometimes that can't be spelled out, what the treatment after the surgery will be, but at least the patients should have some idea of what it is. And usually with ovarian cancer, it's going to be chemotherapy either in the vein or in the abdomen, called intraperitoneal chemotherapy, or no chemotherapy. I strongly encourage, if there's any questions or if there's any issues, to seek a second opinion of a second gynecologic oncologist, just to make sure that you feel comfortable with the surgeon. People shop around for furniture, for gasoline, for food. They shop around all the time. This is your life. Why wouldn't you want to get a second opinion and make sure you're very, very comfortable with who's going to be doing perhaps life-changing surgery? Some questions that you can ask the surgeon to figure out and determine whether this is the surgeon for you are, well, how many of these do you do on a monthly or a yearly basis? What kind of complications have you had or can I expect? And what is your success rate in what's called optimal debulking, which is the goal of the surgeries, to try to remove almost all evidence of the cancer, leaving as minimal cancer behind as possible. The prognosis, the ability to respond to chemotherapy, the ability to go into a remission, and the ability to be cured of the cancer are definitely tied to how much cancer is left over at the end of this first surgical procedure.